judgmental as to how you were taking medicine. I mean, do you guys think about the medication you're taking now? Well, what we will do and what Nature's Care will do is clearly define the medicine you're picking up. It won't be like going to get a bag and that's what you get. We'll look for a plant that's got THC or CBD components in it that'll work for that stuff. So we'll start to fine-tune dosing. And the more of you guys, especially you veterans, if we get enrolled in this program, the more knowledge we're going to have to fix that the right way. And it'll bring components in the cannabis plant suppress dream recall. And if you're a vet that's ever had nightmares, big deal, right? There are people all over this country that walk around every day like that. We're standing there waiting for medicine. There are 500 bags of medication waiting to go out. At that one pharmacy, there are 10 in my hometown of 15,000 people. So how many people in the United States are medicated? And what we're finding, there are 20, with the 23 or 24 states that have medical cannabis, every one that has a regulated law like we are having, has a 25% reduction in opioid overdose deaths. So there's a direct correlation between cannabis usage and a reduction in overdoses. I spoke at a Parkinson's function about 3 weeks ago, and when I was done, there were 6 people that came up to me. None of them were under 70 years old. They were all over 70, 75. All of them had a lot of questions. And they were telling me about their experiences with their current medication. And when I started talking about a guy with Parkinson's that uses chewing gum as his medicine, or a lady asked me about herbal teas, they never thought about that. The doctor gives them pills. You have no idea how it's made. You don't know what, you don't. This is a medication that you can watch from the ground till it gets to you as to how it's made. And because of the way it's bred and because it's an organic plant, every 90 days you can create new medicine. Because the strain that was working for you and this other strain you can put together and get something new. Name one medication you're currently on that's the idea. They just give you more of it or less of it. Or they switch it. What's in it? When you guys watch TV, the one that stands out to me the most is Hugh Herrick because it's on TV all the time. You have a 3-minute commercial. 1 minute of it is the ad for the drug. 2 minutes of the side effects. And then the next commercial is a lawyer advertising his service to sue the company that you just saw the commercial. That's standard. And the reason I bring it up is people sometimes don't see it until I say it, and then they see it. So we're unpacking all of this for the entire community. I'd love to be able to do this statewide, but we have an opportunity here. It's a nice niche, and there's enormous growth potential in the science behind it. We can get more of you guys on board. I don't want one Parkinson's patient. I want all of them. I don't want one qualifying vet. I want all you guys. 100% disabled. The help you're getting from the VA is clearly not up to par. I had a revelation about that a couple years ago before I did this. When the guy was telling me it takes him 6 months to get into surgery, I thought he was kidding. Like, I didn't know that was real, and I didn't know they were mixing up the drugs. I found that out when I was doing commercial roofing because we were up at Great Lakes. So that was the beginning of unpacking all this and seeing how mistreated our veterans are when they come home. The plant has anti-inflammatory properties, and if you think about all of the issues that you have in your body, inflammation and irritation, all of it is inflammation. So the guy that was talking about his wife with dementia, she's going to get an Alzheimer's patch, just like a cigarette patch. On her arm, it will be in her skin. She doesn't get stoned, but she feels better. The reason I brought up Alzheimer's is because the patients have trouble keeping track of their medication now. It's hope for something that could work. And I've had rounds with people that work with patients that are concerned about giving them some false sense of security. They don't have any security with medication. You know what your end game is on your current drugs. I don't have to tell you that. You know it's going to be proven safe and effective since the beginning of time. But it's new. It's new to our civic leaders and new to the medical community. They've been studying synthetic medicine for 60 years and haven't studied organic medicine since the 30s. So that's coming back, and we're kind of driving that through the community conversation. The way to get this done at a bigger level is to make sure that we're hitting the high-level